Welcome everybody to today's Health and Wellbeing Board for Kirklees. Hope you're nice and cool. We've got the fan going, but it's a bit muggy today. I'm going to ask everybody to introduce themselves, but meanwhile, can we just put our phones on silent? And we are, of course, being webcast. So if we start at this end, we'll go front row, middle, back, and then over to this side. If you can introduce yourself and say what organisation you're from as well, you'll need to put the red light onto your microphone by pressing the big button at the bottom.
Hi, I'm Melvin Ingleson and I'm the Chair of Health Watch Kirklees.
Hello everybody, I'm Emily Perry-Harris. I am for 7 more days and counting consultant in public health for Kirklees.
Hi, I'm Warren J. Round. I'm the Head of Nursing at the University of Huddersfield and the Deputy Chair of the Board.
Hi, Martin Gonzalez, Public Health Officer. We're here to talk about the DPH report later.
Afternoon, Lucy Wearmouth, Head of Improving Population Health.
Hi, I'm Liz Towns-Andrews from the University of Huddersfield and I'm the Regional and the Business Lead for the National Health Innovation Campus.
Hi, Steve Brennan. I'm the Director of Partnership Development for the Kirklees part of the West Yorkshire ICB.
Hi everybody, I'm Catherine Riley and I'm representing Calderdale and Huddersfield Foundation Trust.
Afternoon everyone, I'm Tom Brailsford, I'm the Executive Director of Children's Services for Kirklees Council.
Afternoon everybody, Michelle Cross, Executive Director for Adults and Health, Kirklees Council.
Hi all, Councillor Nosheen Dad, Cabinet Portfolio Holder for Adult Social Care and Corporate.
Hello, Stephen Burnell from Kirklees Council. I'm the Head of Policy, Partnerships and Corporate Planning.
Hi, Owen Richardson. I'm the Data and Insight Enablement Lead for Public Health at Kirklees Council.
Afternoon, Vicky Dutchburn, Accountable Officer for Kirklees ICB.
Afternoon, I'm Karen Jackson. I'm the Chief Exec at Locala, which is the community services provider.
Hi everyone, Emma Dickens, Associate Director of Charity and Partnerships for Mid Yorkshire Trust.
Could you shout up, please? I think we've got everybody around the room. I'm Councillor Beverly Addy. I'm the Portfolio Holder for Public Health and Chair of the Board. And to my left, I've got
Alex Chaplin, Strategy and Policy Officer for Adults and Health, Kirklees Council.
And Jenny. That's great. So, we just need to ask if anybody's got any interest to declare. No. And this meeting will be held totally in public. All the items are open to the public. And can we look at the minutes of the last meeting and can somebody move them as a correct record? Somebody? Yeah, Warren, thank you. And a seconder? I'll do that. And that's where we are now. We jumped about. we don't have any deputations or petitions, and we don't appear to have any public to ask questions. So we're on to the main items on the agenda. First of all, I'm going to ask you as partners if you've got any updates on the questions that we've put to you in the past, including things such as how are you promoting healthy activities and well-being amongst your staff. And I'm going to update us on the fact that we've had a very interesting meeting with the Leeds Health and Wellbeing Board officers who've been informing us about how their mentoring programme works. We talked about this previously. I'm hoping we're going to initiate a similar programme here, and that will pair people up with somebody in the community, which will enhance our understanding of diversity from even a socio-economic perspective or ethnicity, all sorts of different areas. And they've reported back to us that their programme was done in a very loose way, so people found their own ways to make those connections. There was no hard and fast requirements, but even so it worked very well, and people were able to bring back some excellent learning and share that with the board. Does anybody else have any updates today? Emily?
I think it's just worth updating the board that Sophie, who does have a surname, Steve, help me, Armitage, thank you. Sophie Armitage has joined us in Kirklees as the lead for the Place Partnership, which is the Sport England funding. It's a period of 18 months that we'll have Sophie with us to kind of work out what the plan is and to put together the fuller bid and awards. So that work it's been going on in the background for a little while to get Sophie in place. It was her first day on Monday, and I know that she's already been in touch via Martin to start to plan out the people that she needs to talk to. But in terms of driving our physical activity, moving more agenda forward in combination with things like the DPH report that Lucy and Martin are going to talk to you about today, it's really important. New blood as well, which is exciting. That's great, and she brings some experience in very similar areas. She's been working on this in the neighbouring authority. We have shamelessly acquired Sophie from Calderdale, where she has previously undertaken the Place Partnership role, so she comes with a whole wealth of knowledge.
So as you say, exciting times tying in with the DPH report. We'll hear more about it in a bit. Anybody else want to add anything at this time? No? Right, so we'll move on. And very grateful to the ICBS CEO, Vicky Ditchburn, who's come, is going to give us an update on the ever-changing landscape at the moment and where things are at. Over to you, Vicky.
Thank you, Chair. I've got some slides to share, so let's just see if they'll share. If not, I'll talk to them. I'll make sure that they're shared so you can circulate them afterwards. I have opened in Teams, so I should be able to. Let's see if we can get this on full slideshow. It's thinking about it. Except it's not going to do it. I'll start talking and I'll just talk to the slides, but as I say, we can circulate these afterwards for people to be able to see. It's a bit slow catching up. So I've been asked today just to give an update on the changes to the Integrated Care Board. So that people are aware, I think we've touched on this briefly before, that at the end of March we were notified that the Department of Health and Social Care, NHS England, were going to have to reduce their workforce by 50%. What wasn't abundantly clear to everybody, the public, etc., within that also included the integrated care boards at places and at West Yorkshire at regional level. And we were given at that time a deadline to be able to do that by Q3 this financial year. So it was going to be at a very fast, rapid pace to reduce our workforce by 50%. And that wasn't just the headcount, it was the running costs that we had to be able to achieve. So I think it's fair to say that's what we've been working on since April, which is a very difficult one. So I'm just going to give you an updated position of where we've got to and the work that is ongoing. So the slide that's up there, and again what we will do is it just shows you what the future landscape is going to be or is proposed to be for the health and care system moving forward. What you can see is we're going to have the national team, and I've already mentioned that they've got to do a reduction, regional teams, then the integrated care boards at place, and then our providers. And there's more strength being built into the blueprints for future provider alliances, collaborations. So that what you can see on that pyramid is there's 4 key elements to this that all have to work together and are interdependent to make this happen. One of the key things to be mindful of is they have all got very different timescales. So we're all doing this in isolation, but they are all interdependent on each other to move forward. So for example, the national and regional teams have been told that their changes won't happen until 27. As I've already said, ours have got to take place by Q3 this year. So you can already see that there's a little bit of a mismatch about where some of the responsibilities, etc., may or may not go in that new world. So for the core ICB, as it will be in the future, the main emphasis is that the core ICB will become a strategic commissioner. So a lot of the functions that we do that are actually delivering services will move elsewhere or be stopped. But under that strategic commissioner, it's looking at a lot of the work that we do already do or we do in partnerships. So that's understanding our local context, developing some of those long-term plans, then delivering the strategy by commissioning it out to the relevant partners to be able to do it, evaluating the impact and that continuous life cycle. So, future roles that we've identified, and what I want to say is that across West Yorkshire, we've taken the blueprint that came out in June, and we've had to read into that based on what it says very clearly and then some of the assumptions it's made. But there's some key functions and key roles that it's saying that we need. So there's the role of the Strategic Commissioner, there's the role of the Convener, and that's about pulling partners together to be able to help deliver and develop services across that health and care system. And then there is what is called the integrator function. And that is a function that's at place-based to deliver a small proportion of services. And this aligns to our integrated neighbourhood teams, the primary care work that we're doing. So it's that element of work specifically. So when you see it in the context of what we've currently got in an ICB, which is roughly 120 whole-time equivalent staff, to bring it down to that little line at the bottom for the place, because that's the place element, you're talking about a significant reduction in workforce. This slide's a bit busy and you won't be able to see it, but when Jenny circulates the slides, you'll be able to see it. What it does is, under those 3 headings that I've just told you, the Strategic Commissioner, the Integrator and the Corporate Capabilities, they're sort of listed out a little bit more on what their exact functions will be. So on the far right, which is the Corporate Capabilities, that's talking about at a West Yorkshire level what will be required to organise an organisation, to be perfectly honest. So it's got a very little bit of workforce, it's got a little bit of EPR, but it's got those support functions around estate, etc. within that. The far left side, which is the strategic commissioning, again, that is going to be a West Yorkshire level function. So that's going to be the elements that will be done once on behalf of the whole of West Yorkshire and then shared back down. So you'll see under there, there's doing the high level needs assessment. So that's taking it at a West Yorkshire level, starting to identify the themes and priorities. And that will then be shared with the integrator functions for them to distill it even further at a place level. There's the strategy and planning, so that's taking all the national direction, guidance, documents, etc. that come out, helping set those priorities. And again, where that will fit at a high level, but then start to filter down so that people build that into their local plans and set their local KPIs around that. And then underneath that, you've got the contracting and monitoring. So this is where we will have, on behalf of West Yorkshire, contracts with our main acute providers, mental health trusts, etc. And they will be held once and monitored once across. So what we will start to find is that we'll join up that activity more, we'll start working closer across providers to be able to do that. It doesn't mean we can't influence what goes in there to manage our local populations, but it's taking the level of work, I suppose, up to be done once. So the middle column, which you can see there, talks about the integrator function. So that's where you're getting right into your local insight and planning, working with the health and wellbeing boards, working at an integrated neighbourhood team level to deliver those services. And including in that is obviously some of those solutions, the designing of what we need in each of those neighbourhoods to feed back to that strategic plan that will sit on the left-hand side. Within that, it'll be about aligning our partnerships. So working as a system of health and care providers, so that'll have local authority as well as our local providers on it, about how we want to start changing and moving some of that activity out of hospital and into the community. So this will then feed into the 10-year plan of the work of moving out of hospital into community, building our digital solutions at place level. So all that sits in that column. What you will see, and it's difficult, is there is some that are in slightly different colours on this chart in those columns in the detail. And they're elements that we've been told in, I'm going to say in the blueprint, so in the national blueprint that arrived, will no longer be functions of the ICB. But at this time, they've not given us a date when these transition out. So in there you can see that there's EPRR management, there is primary care workforce, so continuing healthcare is in there, research is in there as well. So what we've been told is at this point they are part of our functions, but at some point over the next 2 years they will be transitioning into one of the provider arms moving forward. So we've got staff that are going to be in a state of limbo because we've got to make our reductions and cuts, but at some point they're going to have a second move. What it is worth saying about some of those functions, and I'll use continuing care as an example, is there is still no national guidance. So even though that's what they've said is in the blueprint, there is a real risk that when they set the national guidance, they end up saying, actually, no, it's all going to stay in an integrated care board, or it's all going to move to X. But there is no guidance out, and they've been promising it since the end of June, and it's still not arrived. So it could upend all of our plans as they stand now, because that's the bit that I'm saying we've had to do with the known unknowns. Just before I jump, let me go back to that one. What you will see on that slide as well when you get it is it's got some indicative whole-time equivalents at the top of the columns. So just so that you've got this in context, across the whole of West Yorkshire, there's about 1,600 staff. So if we're going down to 50%, you're going down to 600 plus staff. And at some point, all those elements that I've just identified will be transitioning out. So the overall scale of West Yorkshire ICB could end up being as little as 300, 340 members of staff. In that middle column, which is the bit that, as I've said, is going to be the place facing, it says that there's 125 whole-time equivalents. What I want to say there, just so that you've got it completely clear, is those integrator teams are covering Leeds, Bradford and CKW. So that's 125 across all of those 5 places. So if you start breaking it down, you're getting down into the realms of, on average, maybe, if you're lucky, 25, yes. It's going to be small numbers. So that's just to have that in mind as we move forward. So that is a big change for us all. The next slide is just trying to show you now some of the governance that we're putting in place. So across West Yorkshire, as I've said, we've had to move at pace to draft the structures so that we would be ready to go out to consultation. The intention had been that we would have been going out to consultation in July so that we could hit the Q3 deadline that would been set by the national team to be able to start losing staff, that staff would start leaving the organisation. Due to things outside of our control, and that's outside of ours at West Yorkshire, these timescales have slipped. So we are currently anticipating that we will be going out to consult in September. There is a big question mark over that, and I'm going to be perfectly honest. And it was only last week we did tell our own staff that there is a risk to that date again. And that's because the other cogs in the wheel that I showed you on the pyramid, the national and the regional, have not designed their blueprints yet. So what we've not got is the context that we've designed our structures within. So there's an awful lot of risk built into our systems. So because we haven't got that, we've pushed back to the national team saying there are some fundamentals that we should have before we start to consult with our staff, which includes their blueprints. So for those services that are transitioning, we can give people a degree of assurance that if we've done the reductions at West Yorkshire, they will then be eligible for TUPE transfer. It won't be another reduction. There are questions about voluntary redundancy schemes and compulsory redundancy schemes because we've got no assurances where any of the funding, etc., is coming for that. And at this time, we have not got a date. We keep getting told next week, but we haven't got a date for any of those blueprints to arrive. So our absolute cut-off point is next week. If we haven't got those answers and those blueprints for us to have done a final sense check, we will have to take a decision about whether we think we can go in September or we are going to pause and push it back. If we do go in September, what we will be going out with for all our staff is the proposed structures for all the functions across West Yorkshire and at Place, including job descriptions for the roles that we believe are in there so that those staff can see that. So the assurance that I can give is that work has taken place. We have done those structures, we have done the job descriptions, they have been through evaluation panels, so they are sat and ready to go. But if we don't get the assurance that everything else is in place for us to be able to consult meaningfully, we will be pausing. And equally, if for any of those functions or the regional blueprints, something significant has changed so that it puts our structure at risk or it needs redesigning again, we will have to pause and go back to that. And that is a risk that we knew we were taking at the time to move at the pace that they wanted. So again, an example of that is we've been promised all year that there is going to be a national framework for continuing healthcare, which would include guidance around what the future structures should look like. That's never arrived. If that suddenly emerges next week and it is completely out of kilter with anything any of us have been thinking might be in it, we may have to go back and completely redesign that element. What we have done across West Yorkshire now is what we're calling phase 2. So because we've done those first pieces of work, we've started engaging with both staff and partners now about those 3 pillars that I put up there. So what we think they mean, what we think is in there, and what that might mean. And what we've also started doing is developing some scenarios about how they might work in the future in an integrated way across our partnerships. What we've also done is we've set up a transitional board. So there is at a West Yorkshire level a transitional board that meets monthly. And what that board does is it looks at those partnership type arrangements, those that we've already got in place, but also what may need to change and evolve, and also how that work might be done. So there are some things that are clearly not in an ICB's future, but as a partnership, we've all said are valuable and we want to do them. So they're the discussions we're having with the Transition Partnership Board about where they may or may not go in the future. Is it something that we can, as a system across the whole of West Yorkshire, still prioritise or not? We've got a series of committees set up, and then what we also have is twice a week the exec management team at West Yorkshire meet and look at where we're at, look at what's coming out nationally and is it robust and are we still confident? And we keep going back over those designs that we've done which sit with that functional future design group. We have a series of work streams underneath that are looking at things, for example, how are we going to do the recruitment? So again, one of the things that we've done at West Yorkshire is we have mapped that we believe that there's going to be at least 1,000 staff are going to have to be interviewed through this process. If we have to do it in a very quick time frame, we know that it's going to take at least 6 weeks interviewing every day, having at least 6 interview panels a day to get those 1,000 staff through the interview process. So what we've done is we have modelled a a scenario that basically says we can do that. So we've got a whole schedule set up. It's doing it on like a waterfall process. So you start with the more senior posts and work down. And within that, what it also does is that takes us through to February as it currently stands. But what it does mean is we're not hitting that Q3. So I've said all along that's the deadline we've been given, but from a safety aspect we know that's not achievable. So we've already flagged that, but we have it mapped out. Again, what we all need to just be really mindful of is if the national information doesn't come out in the next few weeks, so our consultation period doesn't start at the beginning of September, everything moves and moves backwards. Because the way we've built it at the minute, and I'm saying built it, is we've allowed for a 45-day consultation period. We've built in a 2-week standstill period where we can review all the information that comes out, put a date in that we then formally close that consultation and tell staff this is the actual structures, and then within 3 weeks of that date, it starts interviews. So you can see how tight it is, and you can see that anything gets moved, it's going to move everything as part of our process. So we've submitted everything that we were asked to do back to the national team. We submitted it at the end of May for consideration, which is what they asked for. We know that a briefing took place at the beginning of June, and we were asked to put some clarification points on. I think it is fair to say that what has transpired from that is that across the country, every region has done it differently, which is no surprise given that there wasn't clear guidance that said you've got to have A, B, C and D. So what we have found looking at that is that some areas have included things like continuing healthcare, safeguarding, etc., because they are part of an ICB structure. Other areas have chosen to ignore them and not include them. So some it's in the £19 a head, some it's not. And we're still waiting to see if there's going to be clarity about whether it's in or not in, because they've not given us any definitive answer on that. What we have been told at West Yorkshire is the approach that we have taken has been robust and sound, and some of our exec management team have been asked to go to other regions to explain how we have done that, and also to explain what our planning process has been to make sure that we've got all the other bits lined up, like the job descriptions, etc., because other places have not done those either. But as I say, the biggest risk in all of this is that within that £19 head of allocation, what people have included and not included, and the fact that we've had no formal feedback to say what you've got in there is 100% right, or you've not got it in and you need to put it in, is leaving everywhere across the country at risk, because that is some of the changes potentially we may have to do. So they might come back and say, West Yorkshire, you put continuing care in, Manchester didn't, we've taken a decision, continuing care's not in. That's a plus to us because we take it out. What it does mean though is we've got to look at all our other structures because we'll be well put under the £19 a head. Does mean more staff might be safeguarded, etc. But that is the real risk that's going around this. As I've said, our intention is that we will be going out to consult on the 3rd of September, and that's the plan that we've put in. And that's what we're telling staff, though we have, as of last week, told them there is a potential that we might not. That is very unsettling for staff, because staff have been working all year thinking this is going to happen at a rapid pace, and getting the heads around the fact that 50% of our workforce is going to be going is hard enough without always being told, oh, we're moving the dates. And trying to say to staff, that's not us at West Yorkshire, it's not us at Kirklees that have done that. It is a national position. Across Kirklees, what we have done is built in lots of touch bases. So what I can tell you is that we do staff briefings at a West Yorkshire level every 2 weeks. Every 2 weeks we also do a briefing at a Kirklees, so I run a briefing at Kirklees. It doesn't have a set agenda. What we certainly use that briefing for is to allow people to come and ask questions, put challenges to us, any queries, any points of clarity. And then the second meeting, I have another one every month with people, is we do our business as usual, because we're still all working really hard, and to keep motivation up, what we're trying to do is make sure that people see the good work that we're still doing. We're still moving ahead with our integrated neighbourhood teams, etc. And we want people to be invested in doing that. So I think I'm going to pause there and I'll take any questions. This is a challenging time for us. We will keep you updated if we do actually go out to consult, but it's where we're at this point. And I'm now going to try and stop sharing.
That's fantastic, Vicky. Thank you for bringing us such a comprehensive update. We really just put this on the agenda for an update, unless somebody needs clarification on something, because you're still in, it's a fluid situation. We're just, well, from my point of view, really delighted that we've got a capable, firm hand at the wheel. And what I'd like to ask at this time is that we're all partners in this health system, that we're here behind you, supporting you. I'm disappointed to hear that the cogs aren't all turning at the right speed when you're being asked to do stuff. I do hope that we get the information through, and I'd like to think that the partners in the room that can support you, if you can turn to them at any time. Really glad that, you know, the ongoing work has to go on, so those are sort of places where people can probably, you know, put in an extra bit of effort, because you've got to get this other bit done, and, you know, the sort of integrated neighbourhood stuff still needs to go on. Thank you very much, Vicky. Has anybody got any points for clarification or anything that they need to just at this time? Because I'm sure Vicky will come back to us with, you know, more updates as it unfolds. Tom.
Thanks, Chair. Yeah, I mean, it's just to say, you know, we're all really supportive of colleagues across the ICB and the work that's going on and the pressure that they're under. So I think, you know, we all recognise that. I think it's just worth flagging there is a couple of statutory risks, which is not to do with our local ICB, to do with the national arrangements. So the statutory responsibility for SEND is unclear. The statutory responsibility for children's safeguarding is unclear. And that's happened at a time where there's significant reform going on in children's services through the Children, Family and Schools Bill. So it's just to assure the board we're keeping a close eye on this and raising that as a group of DCSs at a national level, but it's just worth flagging that risk. But obviously that's nothing to do with local colleagues, that's about the national blueprint.
Well, that's great to hear, Tom. I'm sure you're across that. But again, you know, people want this to work at pace. They really must be providing that stuff and the continuing care stuff as well. So, it's Karen.
Sorry, thank you. To reiterate there what you've said, I mean, it's difficult, this, isn't it? And it needs all of our support, so keeping close to each other is important. The other thing I think we need to keep our eyes on, and I know you do this, Vicky, is that actually we work really well as a partnership, and there are certain arrangements in place that help us do that in a really constructive way. So we do need, and I know there was a time out yesterday morning for the start of the discussion, but we do need to understand how we will continue to work like that, and how, whatever the arrangement is, continues to support that stuff that's really brought us together and kept us going in that direction. So, yeah, just to say we need to just make sure that happens. Thank you.
Yes, that's, yeah, very good point. We do, and I think this board is going to be an important role into the future in that. And working together is the only way that we're going to be able to manage this, especially with diminished resources in the ICB terms. When we get forward, I'm sure Vicky's going to pull something together that's going to work wonderfully. I welcome to the room, just for those who are online and haven't seen, James Cregan from Kirklees Care and Calderdale Care Association. And also Joanne Sanders is going to present the next item, which is just for information to give us some assurance on the work being taken to understand, to ensure the sufficiency of provision for children with special educational needs and disabilities in Kirklees.
Good afternoon. Thank you for having me this afternoon. My name's Joanne Sanders. I'm Service Director for Learning and Early Support at Kirklees Council, and I'm also the Senior Responsible Officer for our SEND Transformation Programme across Kirklees. Thank you for the opportunity to bring our SEND sufficiency strategy. It's here, like you say, Chair, for information, but also assurance that we're trying to get ahead of the curve in terms of planning to make sure we've got sufficient places, learning places for our youngsters in Kirklees. The strategy, it reflects our ongoing commitment to make sure that we can, wherever possible, make provision for youngsters to be educated locally and that they're in the most appropriate type of placement to meet their needs. So this is right the way through from the early years, right the way through to opportunities post-16, and that includes employment and training. We do know we've got some more work to be done, particularly around some of our youngsters who have social, emotional, mental health needs, as well as those who have autism. But what we've tried to do here, we've tried to take a long-term view, forecasting demand, and we've done that by using live information about the youngsters that currently have an education, health and care plan, and we're looking forwards. So, for example, if youngsters are currently in reception year, and we understand their needs, then we're able to plan forwards as they move into secondary education and post-16. The strategy complements our work on the safety valve programme, which, as you know, is related to something we signed up to with government, and it also outlines what we are undertaking in terms of making sure that it's not just enough places, but the places are of quality. It outlines some of the work that we've already done. We're on with building two or rebuilding two brand new schools. They are existing schools, but will have brand new facilities and will have increased capacity. We've got work starting imminently for our Joseph Norton rebuild, and work is beginning and planning permission has been received for Woodley School and College. So these are really exciting developments. What we aren't doing is just resting on our laurels and waiting for new builds. We're also working with our mainstream provision. We've been working with schools in clusters so that they feel better equipped to meet the needs of youngsters in their mainstream, their local school. We've been investing and growing our additionally resourced provisions, which complement mainstream but give some additional capacity for particular types of specialisms. We've also included in this strategy alternative provisions, so youngsters who might have medical needs that are preventing them from attending school. So whilst we're not there yet, we are looking forward and making sure that this sets out our ambitions for the next 3 to 5 years to come. I think if you note in the document, it does talk about next steps. It describes an SEND sufficiency group, which is now meeting monthly, building on the data that's underpinning this document, and that will help us to plan and commission ahead. And just at the end of the document, what we've tried to do, so that helps our system to help us meet need, is summarise where we think there's growth in need, where we think we need less of, which there are many areas that we need less of at the moment, but also the areas that we'll be looking to develop and the types of those, and that includes ARPs, alternative provision, as well as specialist places. That's it. Thank you.
That's great news, Joanne. You know, you obviously look into the individual specialist provisions that have been revamped, and that the James Norton, the Woodley, and those mainstream interventions and work in there. Sounds like we're going to have some fantastic updates in the next 3 to 5 years. And, you know, I'm really keen to welcome that. That sounds brilliant. Anybody got any specific questions? No, and you've got in your agenda pack, you've got the big plan. So you've got some more details to take away with you there that you can look at. on that subject, and I look forward to hearing more as it all comes together about the individual things that you've got going on there. That sounds fantastic. Next up on the agenda is the Director of Public Health annual report. Unfortunately, our Director of Public Health is unavoidably not here. So we have Lucy Wearmouth, who's going to present the report, and it really ties nicely in and underpins our direction that we're going into in Kirklees as one of the arms of the way we're going to try and work forward to improve the well-being of all our residents. So I'll hand over to you, Lucy, so you can press any buttons you want. I'll turn mine off.
Thank you. Good afternoon. We're just going to sort out the technology. Hold on. I'll start whilst Martin's trying to sort out the technology. So, good afternoon. My name's Lucy. I'm Head of Improving Population Health. I work in public health. And like Councillor Addy has said, Rachel can't be here today. So you've got me and Martin and Owen. Owen is doing a lot of talking later on. So we're saving Owen, and me and Martin are doing most of the presentation today. So we come here every year to bring Rachel's report. So this year the report is on physical activity. So what we're going to do today is talk you through the report, the main themes of the report, and then get some feedback from yourselves about next steps and where you think as a board this needs to go. Brilliant. Thanks, Martin. Okay, so first slide, please. There we go. Next one. Okay. Thank you. So we say this every year, but this is Rachel's report, but obviously we want it to be shared by Health and Wellbeing Board. This is the start of a journey, and we want to obviously take this forward. What we don't want is for us to produce a DPH report every year and then for it to just kind of land and nothing happen. So after we've been here today, we plan on going on a bit of a road trip for the report. So what we'd like from yourselves is some feedback about where else you think it would be useful for us to bring this. So just in terms of a bit of an introduction to the report, for those of you who might not be aware, Rachel can choose the focus of the report each year. It's Rachel's independent professional statement about the health of local communities, and it's important to state that it is separate to the political decision-making processes of the local authority. We always really try and use the report as a vehicle to kickstart conversations and systems change, and that's the same thing that we want to do with the report this year. It's a key resource. We want it to be a key resource to inform stakeholders of priorities and also to recommend actions to improve and protect the health of the communities in which we all serve. Next slide, please. So the title of the report this year is Physical Activity Matters. Obviously it's on physical activity. We've wanted also to take a very specific focus on what inequalities there exist in relation to physical activity. It is the start of an important journey, like I've said. It's not the end, it's the beginning. We're focusing on developing a systems understanding of physical activity, including influencing factors and the associated inequalities. The report itself isn't intended to provide solutions. We have got some next steps included in the report. The report is, fingers crossed, will be live online today or tomorrow. We'll obviously share all of this with you. Ongoing work will happen after this report, which will give further insight into local communities, and then our intention is that the collective findings will then drive forward local actions across systems. Thank you. So I probably don't really need to say much of this here because I know that you'll all be very well aware of the importance and the benefits of any kind of movement or physical activity. So in terms of a definition, we have got a definition in the report, but when we talk about physical activity, we just mean moving your body by using energy. Physical activity is obviously a really important tool for preventing and managing a wide range of health conditions, and it also improves cardiovascular, mental health, and reduces the risk of chronic diseases. But more than that, there is a massive added value in terms of the impact which physical activity has, both for individuals and for communities. And we want to recognise that in the report as well. So we're thinking about the benefits beyond health, how it fosters social inclusion, bringing people together, community cohesion, and economic productivity. And we've got a quote here that we just thought kind of summed it up really nicely. So this is from Dame Sally Davis, who is the former Chief Medical Officer, and she said, "If physical activity were a drug, we would refer to it as a miracle cure due to the great many illnesses it can prevent and help treat." Next slide, please. So in the report, we have included the Chief Medical Officer's guidance on how much physical activity different groups of people need to be taking each week. So that is across the life course, ranging from children and young people to adults to older people, people with disabilities, pregnant women. So we've included that within there. So just as an example, young people aged 5 to 18 years should aim for 60 plus minutes per day across the week, and adults should aim for 150 minutes of moderate activity per week. Just a reminder that that is both informal and formal physical activity. And I think the thing that we want to emphasise within this, I think, is when as an adult you see adults should be aiming for 150 minutes of moderate activity per week, that can be quite I think that can be quite overwhelming as a definition of how much we should be doing. So really what we want to emphasise is that some is good, more is better, and for the people who are most physically inactive, just doing some physical activity has huge benefits for the health. Thank you. Obviously, we've got a section on inequalities. So we know that within Kirklees, around a quarter of adults and children do less than 30 minutes of physical activity each week. So that's our definition of what physical inactivity is. Underneath that, we also know that there's a range of inequalities which exist underneath that. So we have the data from the 2021 Click survey. We're doing a new Click survey soon, so we'll obviously be able to update this. But what we know from that data is that the rates of inactivity are 3 times higher for people out of work versus those in work. They are 2.5 times higher for people ages 75 plus versus ages 19 to 74. 2 times higher for people with a disability versus those without. 3 times higher for those in most deprived areas versus the least deprived areas. And finally, they are significantly higher for people of Pakistani ethnicity compared with those of white British or Indian ethnicity. I think the thing that Martin will talk about a bit more is that underneath that, there are kind of a multitude of reasons why there are those inequalities exist, and they're very complex due to social, environmental, economic factors. So it's really important in the report that we're kind of taking that systems approach to understanding those inequalities. Next slide. So in terms of what we can do to increase physical activity levels, we've used the World Health Organization's Global Action Plan on Physical Activity. So they have 4 recommendations which help us to see the complexity of physical activity and the different influencing factors of that. And they've broken those down into 4 different recommendations. So there's more detail contained with that within the report, but the recommendations are active societies, so promoting awareness and cultural change through campaigns and community initiatives. Active environment, so that would be things like your roads, how you get about, your parks, your open spaces that enable people to walk, cycle and play. Active people, so what are we doing to support individuals whether that's through education, healthcare, community programmes. And then the active systems bit is the thing which I see as kind of sitting underneath everything, which is about the physical activity and all policies, really strengthening governance, and then the systems working, like bringing this report here to you today. And now I think it's over to you.
Thank you, Lucy. Yeah, so as Lucy says, this is a really important topic, and it's actually included in the health and wellbeing strategy for Kirklees as an ambition, and you can see the statement there for yourself. But as Lucy says, you know, these inequalities that exist exist not because of those very simplistic sort of definitions or categories that we've looked at, but because of a wide range of complex factors. And the rainbow model there sort of illustrates the fact that there are individual lifestyle factors, there may be living and working conditions that impact on people's health and well-being or their ability to be physically active, but there may also be wider socioeconomic, cultural and environmental factors that impact people as well. And all those different things can apply to the same person at any one given time, or individual elements of that might apply to people. So it is a very, very complex and broad spectrum there. And when we're talking about what we want people to do, we want people to be able to move more in the way that works for them, and that can be anything from just literally getting them to move more to people taking part in high performance sport and anything in between, formal and informal activity as well. So you know, the barriers that exist to people can be complex and challenging, and those inequalities that we've seen locally exist nationally as well. Our pattern is very similar to the national pattern that Sport England show every year in the Active Lives survey, and that pattern has existed for forever. It's not a new thing. So this is something that whatever we've done historically has worked for a number of people, but it hasn't worked for a number of other people, and that can change for that person at any stage in their life. There may be times where they are active and then other times where circumstances have meant that they are less active. So we need to take all of that into account in our thinking. So when we look at, you know, how we can influence an individual and support them to be more active, we've looked at the COM-B model, which highlights the importance of capability, opportunity and motivation in somebody being able to adapt their behaviours. And those factors that are highlighted in that previous rainbow model are things that absolutely play a part and may change at any stage of people's lives. And we need to be cognizant of what they are and how we help people overcome some of those challenges, some of which may be systemic. And that's where our particular interest is in where can we make a difference and remove those barriers so that remove them for myriad people rather than just on an individual by individual basis. But we also know that from the health and wellbeing strategy and the I statements that are in there that people want to move more, they want to be healthy, they want to be able to do things for themselves. And some of the statements are included there about having safe and accessible local places, access to affordable activities, a local area to be disability friendly and that is accessible to everybody, and the importance of accessing green, natural and outdoor spaces in a locality as well. So we know a lot of things that people are telling us, and we're continually trying to engage with communities to understand that in more detail. But we do have a lot of assets, and without this is not the forum, and this report is not the report to talk about the quantum of those assets and where they are, but there are a range of assets that exist in Kirklees that give people a wide range of opportunities to be active, and they range from everything from our outdoor space, our parks and green spaces, to recreation park areas and play areas for people. There are sessions that support people to be active who may have challenges to be doing so, and things like street bikes who do fantastic work with in terms of inclusive cycling, and our music and games in chair sessions for people for whom mobility might be a challenge but can still be active. They're great examples of some community-led initiatives. Our school sites have great facilities and often open those up to the communities as well, but they also support bikeability and the teaching our young people how to cycle, which is obviously an important skill and has safety benefits. And then we have a range of leisure centres and swimming pools as well that CAL operate on the behalf of the council, and they also provide things like school swimming, which is a statutory function for education, so they support education in being able to deliver that, and that is a key life skill as well. So there are a range of opportunities and assets that are there, and we absolutely want to maintain those and enhance those. But at the same time, as I mentioned before, we do recognise that despite all of those things, there are still too many people who are inactive, so they're not the answer for everybody. And we need to also think a bit differently, perhaps, if we want to reach some of those people who are less active or inactive. We have included in the report some examples of the great work that is going on. Street bikes is one example we've included, Ravensthorpe Community Centres another, the work internally with the Council of Community Plus and how they're supporting the community has also been included, and the work of Kirklees Active Leisure, but specifically looking at CAL's work on some of their work with people who've got health conditions or specific barriers and how they're supporting them. We wanted to highlight that because that's a really strong example of partnership working and trying to do something in a tailored and tackling the systemic barriers. So there are examples in the report that you can have a look at. And as Lucy mentioned, there are sort of some next steps. Fundamental to all of this, that the report is highlighting the need for us to work in collaboration with communities and work with them and not do to them, which reflects the way that many of our partners and the council try to work generally anyway. We need to understand what people want and need, so research and insight is really critical, and we need that to be place-based because the wants and needs may differ from place to place and from cohort to cohort. But we are fortunate that Kirklees is going to be a place that's part of the Partnership Expansion Programme from Sport England. We've got some money at the minute as a development award, which has allowed us to recruit Sophie, who Emily mentioned earlier, who's going to then give us capacity to actually lead and drive that work. That is a Kirklees partnership programme, it's not a council programme, so although Sophie is hosted in the council, that work is actually going to be steered and driven by a range of partners, and I think that will give great benefits. There's a potential to empower community champions and others to actually promote physical activity locally and talk to people about what that means, and that it doesn't necessarily mean something structured or that costs money or that's organised or that they have to go to a particular place to do, but how they can just look to incorporate movement more into their day-to-day routines. And we do need to refresh and develop a new physical activity strategy for Kirklees. The current Everybody Active strategy expires this year, so there is the need to refresh that. And this report is intended to provide a framing in terms of what that strategy needs to focus on, and in particular who. We think it's really, really important that a big focus is, or a bigger focus is placed on the people who are inactive and the people who are coming from most disadvantage, to support them to overcome some of those challenges and barriers to become more active and reduce some of those inequalities that we've seen. To do that, because it's so complex and there are so many different things that impact on physical activity, directly or indirectly, we really need to have a big emphasis on embedding physical activity in all policies. It follows that wider health in all policies approach and is absolutely consistent with that. And there are things that we might be able to do more immediately, generally promoting the physical activity, encouraging people to be more active, whether that be as employers, whether that be in things that we do outside of work as well. That's a call to action that applies to ourselves in the council and to others as well. And finally, as Lucy's mentioned, the report will be public and it will be visible on the council. The link is included there. We're hoping it will go live today. If not, it'll certainly be live before the weekend, so you're able to have a look at it in more detail there. But thank you for listening to us, and if you've got any questions or queries, we'll try and answer those for you.
Thank you, Lucy and Martin. And thank you, although she's not here, to Rachel Spencer-Henschel, who's chosen this as this so important element to make her report this year about, and it really fits in with the way we're moving forward in Kirklees, underpins everything, and, you know, to my mind, it's the perfect topic. It sounds simple, doesn't it? Moving more, but clearly it's not, and we have to work on how we motivate people. We've got those things in place and the information coming on, and for me, it's the individual health is so important, but the knock-on benefits, retaining independence and those community cohesion and community development things that we don't think about. So we have to work out how we motivate people, how we get them to come on board with this, and I think partners are going to be really important. All-round partners today is the theme, isn't it? And that's what this place is about. Does anybody have any questions? Steve?
Thank you, and thank you for the report. Mine wasn't a question, but it was just in answer to one of the asks about being able to bring this report in front of various partners. So I'll get in touch separately and we'll do a similar thing to what we've done with the 2 previous DPH reports. So.
It was just to say thank you to the team for the enormous amount of work that they've done to create this report. I think, Councillor Addy, you're absolutely right. It is such an important topic. It's the moving around more. It's those people who are entirely physically inactive and what this can mean for them. And I'm really keen that we emphasise that language. That feels important to me. I think recognising the role that helping people move around more can have in terms of community cohesion, in terms of social isolation and loneliness. The physical activity is an important outcome, but it's an outcome of its own. It's the other things that come with it that feel really important to me. How do people feel about those green and blue spaces that they have available to them? Do they feel safe in using them? The fact that they've done 10,000 steps to do that's just a bonus.
Great. Anyone else, please?
Thanks for that, really interesting. Yeah, in the past, the Director of Public Health's report has come into the Executive Board at Calderdale Royal and been really welcomed. So, yeah, if we can do the same this year, that'd be great.
In a small part, this is one of the things that I'm interested in with our, we're all big employers. Can we have a lot of staff, maybe certainly in hospitals, nurses, and they move a lot all day, don't they? So, but there will be people who are sat in offices and just getting them moving. We can all do our little bits to push forward, as well as the big plans that we have. And those who move the least, moving that bit more, is where we'll get the biggest impacts, I believe. She says, looking at Emily for confirmation, but yes. But that's it. We can all benefit from doing that bit more and look forward to our moving forward on the moving more generally over the next few years. Next up, we have Owen with our pharmaceutical needs assessment. Sorry to lose you behind Lucy earlier, Owen, I missed you there.
Thank you. Yep. Good afternoon, everybody. So I'm just here to very briefly update you on where we're at with the P&A and hopefully to get final sign-off from the board. Just to give you a recap of what a P&A is. Pharmaceutical needs assessment. Every health and wellbeing board in England has a statutory responsibility to publish and keep up to date a statement of the need for pharmaceutical services for the population in its area. And this is updated every 3 years, so we're on that cycle at the minute. I came to the board in September to describe the timeline for that process. I shared a draft copy of the P&A in February this year, prior to going out to 60-day consultation. And that consultation period happened in March and April, so that was the 60 days there. In total, we had 4 responses to that consultation, 2 from members of the public, and bear in mind that members of the public had already previously had chance to input into the P&A, so the public voice was represented as part of the draft P&A initially anyway. Nothing was raised in that consultation that required any significant changes to the draft version of the pharmaceutical needs assessment that was shared previously. So the conclusions remain valid based on the consultation. I've also incorporated any changes in pharmacy provision that have happened between the draft and now, ready to publish. There was one consolidation of 2 pharmacies onto one site, and there was I think 4 changes of hours. 2 had increased their hours and 2 had decreased their hours. Again, none of that substantially changed any of the conclusions in the the P&A. So I've now got a final version of the P&A which includes all the information about the consultation and incorporates the changes to the pharmacy provision that we've seen since then. I've shared, as part of the papers for this meeting, I've shared the exec summary, and I've shared the additional appendices that cover those extra bits of information. So my proposal today is that if you're in agreement, the P&A is signed off and we'll go ahead and publish. We need to publish by the 22nd of September or the 21st of September on the website, on the council website, in order for when the old one expires, the new one is ready to go. So yeah, that's it.
Thank you, Owen. And pharmacies are playing an increasingly important role in that neighbourhood intervention with the Pharmacy First, and from personal experience, it's a very, very good role, and it's important that, you know, the pharmacists are part of that community, a trusted voice, and can really save a lot of time with GPs and A&E. Has anybody got any questions before we ask to approve this? Can somebody propose that we accept this? Tom, and the seconder? Steve? Okay, everybody's in favour of that? Thank you. And next up, we've got Owen again, haven't we, Owen? And this is the Kirklees Joint Strategic Assessment update.
Thank you. I've just got a couple of slides that I'm going to share with you. Just let me join the meeting and share those. Thank you. Yeah, so I'll just give a very brief background to what the KJSA is and where we're at with it and what our next steps are. So Joint Strategic Needs Assessment, JSNAs, are a requirement of health and wellbeing boards. It came with the Health and Social Care Act in 2012. At that time, it was local authorities working with clinical commissioning groups, and the JSNA is a summary of the health and wellbeing of the local community. Public Health England, as it was at the time, defined the purpose of a JSNA as a systematic method for reviewing the health and wellbeing needs of a population, leading to agreed commissioning priorities that will improve the health and wellbeing outcomes and reduce inequalities. And guidance at that time suggests that a JSNA should provide assessment of health and social care needs, include place-based population health analysis, adopt a system-wide approach to health inequalities, and create an evidence base for local strategies and commissioning. So that's the purpose of a JSNA. That guidance is quite old but has not been updated since then. So that's the guidance that we're working with. In Kirklees, the Health and Wellbeing Board delegated responsibility for the production of the Kirklees JSNA to a steering group. And in 2015, there was agreement that the JSNA would be rebranded as the KJSA, Kirklees Joint Strategic Assessment, to place a greater emphasis on assets, although needs are also still included. And at the same time, the KJSA moved to being a web-based product. Previously, it had been static PDF documents. There's also agreement that an updated overview section will be presented to the board annually, and then other sections would be updated on a rolling 2 to 3 year schedule. And that happened up until 2020. Whoops, sorry, let me go back. In 2020, all work on the KJSA was paused due to other commitments, shall we say. And there was a very limited update in 2021. In 2022, we shifted most of the content into an archive section. It was starting to get a little old, was the content. And there's a product that OHID had produced, which is called A Picture of Health, which is a profile which generally uses very similar chapters to a JSNA. And has got local data in it. So we use that as our primary source of data within the KJSA temporarily. And in 2023, work began to redesign, update and relaunch the KJSA with the intention of reducing the number of sections within the KJSA, reducing the content volume to make it more manageable for updating, and also to bring it in closer alignment with the health and wellbeing strategy. So that's what's been happening in the background. We have a new site structure, which has got broadly 6 different sections to it. Again, this is with the health and wellbeing strategy in mind, but also thinking about the health and care partnership wells as well. So there's an overview section, which includes an introduction, the overview, and also some resources and the archive. A people section, which gives a summary of the population of Kirklees, looks in more detail at inequalities, factors that impact individuals, and also factors relating to how we feel. The place section will include place summaries, so this is locality summaries within Kirklees, and also look at factors that relate to healthy places, and also bring in community aspects as well. The wider factors section includes the wider determinants of health, a section on poverty, and also sections that look beyond Kirklees. So one looking at factors that impact Kirklees perhaps from a national guidance point of view, and then also the West Yorkshire perspective. So thinking specifically there about the combined authority and also about the broader ICB, ICS systems at West Yorkshire level. In terms of life stages, these align with the wells. So we've got a starting well section, a living well section, and an ageing well section. And also within those, we'll have subsections that address specific health issues, health conditions, and also look at specific health behaviours as well. And then finally, under other priorities, we've got the dying well section, and we've also got a section on mental wellbeing. So those are all the new sections within the new structure. In terms of where we're at currently, most of the sections are in progress as we stand. You may not be able to read all the detail here, but the ones that are highlighted green are complete. The ones in yellow, if that comes out on the screen, the ones for August and September are almost ready, so they'll be ready to go within the next month. And then the others will all be ready, estimated completion before the end of this calendar year. So that's where we're at. So everything is moving forwards. And then finally, just some next steps. So the new website structure will go live within the next few weeks. It'll include the completed sections that I've just mentioned, and it will have holding pages for the other sections that are not yet complete with an estimated completion date in there. None of the existing content will be lost. It'll be archived, so still available via the site. And as I said, all sections will be updated before the end of this calendar year. And before the end of the year, the steering group will also agree a future updating schedule. At the minute, we're concentrating on getting the current content out there, but we'll then look at how we can manage and maintain that content going forwards. And it will all be still available via the current existing link for the KJSA, which will be shared within the slides. So that's it. That's it. Happy to take questions.
Thank you very much for that, Owen. It's very comprehensive. Have we got questions on the KJSA and where we're at with that? Vicky?
Thanks, Chair. I think there's something for me in, and I was trying to read your contents as you flash them up, but there's something for me about the link back to integrated neighbourhood teams and the priorities that they're doing. So I saw cancer and respiratory, but I know that frailty, for example, is a big one. So it's making sure how that data links in, and I'm going to say it's accessible to people. So we're talking the same language, using the same words, that if the GP's got on that and they're wanting to draw off information, they can clearly see where it is as well. So there's just some thinking about that I think we need to do.
Do we have any further oversight on that, Owen? You take it back to people to look at as it's coming together for, the professionals to have a look at the language and things like that. Does that happen further down, or have we done all that?
That's part of the steering group process. So we for every section, we've got topic experts involved in writing the content, and we're also linking in with relevant partners on that. There'll be an element of the frailty will come in with some of the other, the life stage sections, the ageing well section, for example. But as a separate health condition, we can look to include that for sure.
Hi Owen, I'm just checking, have you got all the input that you need from all the organisations in the room, or is this a request for more input? You know, when you say you've got a steering group and you're talking to experts, have you got everything you need?
That's a very good question. Thank you for asking it. I think each section is different and each section requires input from different people, and we will bring that. We will have those requests as we go along. We've got representation within the steering group from the relevant organisations, and then it's a case of reaching out from there. It's not the responsibility of the steering group necessarily to do all of the work or to provide the content, but the steering group is the link to the people that can provide that expert input. So I hope we do have those links to the right people via the steering group. Yeah.
Anyone else? Your mic's not on.
That's better, sorry. User error, I think. I'm just reflecting back on what Vicky said at the beginning and tying it back to this. And I'm just wondering if what the position is really of Kirklees as a council, or indeed local government nationally, as to whether this will remain a statutory obligation for local authority, or whether there is a realisation that all of this might get swept out when the 2012 Act is removed. Which my understanding is it's going to be integrated. What's left of the 2012 Act will be integrated into the new 10-year Plan Act when it comes to Parliament. And this is incredibly valuable for the community, incredibly valuable, and also extremely good work. I mean, I can see that as an outside party, but I'm very concerned that suddenly this will become a statutory duty of the ICB, and some of that locality, rich data insight will be lost. So I just wondered what colleagues, partners thought.
Do you have any information on that, Owen? Or
I've not heard anything about that at all, but my view would be that we would still like to have something, even if it's not called a JSNA anymore. I think you're right there. I think as a product it is really useful to a lot of people, and yeah, I would like to maintain that anyway, regardless of what the statutory regulations are around it.
I mean, there's always a scope for the council to bring something together through partners anyway. Emily?
I would absolutely agree with that. I think it's something we would want, whether we were told we had to have it or not. I think it would be a real shame if we weren't able to bring together that information that helps us describe our population, and I can't quite see how we would be able to do population health management or the integrated neighbourhood teams or whatever three-letter acronym we want to call it on any particular given year without that. So I haven't heard anything specifically that suggests that it's going, but even if it did, I'd want to keep it.
Okay, thank you.
Were you coming back on this specific, Vicky? I'll come to you after that, Tom.
Yeah, what I was going to say is I think this becomes a piece of work. So we've already said that partnerships are going to be crucial, regardless what happens at West Yorkshire level and filters down. What we deliver at place is going to be crucial, albeit with a different workforce, and we might have to look at how we prioritise. So it might be that we say we condense it down, or we find an easier way of doing it, or we do it AI, as we've been talking. But I think it's invaluable information, and it's going to be part of the suite of packages that our integrated neighbourhood health and teams need to be able to localise that information. So I would see this talking to whatever comes from West Yorkshire and vice versa.
Yeah, that's great. I mean, we'll keep our eye on this. And if you can report back if you hear anything at the earliest opportunity, so that we've got our eyes over anything that might be coming and how we might have to look at how we move forward differently. Tom?
Yeah, just to come back on that before, my comment to Owen as well. I was at a conference 3 weeks ago where Tom Reardon, the second Undersecretary for the Department of Health and Social Care, was talking, and I guess one of the things he was saying about the 10-year plan is the neighbourhood plans will be overseen by health and wellbeing boards. So if the neighbourhood plans are overseen by us, we need that intelligence function, like Vicky's saying. So we've always had, whether it was KJ, SNL, we've always had a council intelligence function, and I can't see it going anywhere. Just question was just about the children and young people survey, Owen, and if that's going to happen again as part of the refresh, and if it is, are we thinking about different ways of administrating that, given you know, the online nature of most of the work that our children and young people do?
Sorry, the question was about the young people survey. Yeah, so the young people survey has just happened this summer term, just gone, and we'll be issuing the results of that around September time. I think the intention is to continue with an annual survey and potentially look to broaden it out. I think we say that quite often, that we'd like to broaden it out to other school years, for example. It's just a Year 9 survey at the minute. But yeah, it's very much an important piece of intelligence for us is the survey. Yeah.
Anybody else? Great. Thank you for that, Owen. That's great. And our recommendation here is that we continue to support the KGSA from the board, you know, including its promotion and using it informing commissioning and prioritisation, which I'm sure you all will do. Next up, we have the Kirklees Partnership Framework Review, and we have Stephen Bonnell to present that.
Hi everyone. I'm aware that some of you have seen this before because we are going around various partnership for. I think one person in this room has seen this 3 times before, but the more engagement, the better, I think. So we're just loading some slides. They're coming up. Yep, great. So first of all, what is the partnership framework? So some of you will be aware of this diagram. What it shows is how the partnership strategies that we've got contribute to the shared outcomes which have been agreed through various partnership fora previously, and therefore contribute to the vision that we have for Kirklees. And these are partnership driven because we can only deliver those things in partnership. So the council obviously has a particular role in contributing to those outcomes, but so do health partners, so do community partners, businesses, education partners, and so on. And this sets out a high-level framework for collaborating, for describing how we collaborate. You'll notice that the health and wellbeing strategy, of course, is on there as one of the top-tier partnership strategies. And this is primarily about how we collaborate between organisations, but of course we collaborate on an individual basis and within our organisations across the different teams as well. But every organisation has a kind of role in contributing towards those outcomes and that vision. So, as I said, how is the framework used? It's used in different ways by different partners. As I said, we use it to describe the way that we collaborate with partners. So that's in our council plan, that's in conversations West Yorkshire level with partners in national government and so on when we're describing the activity that we have locally. It's intended to structure some of those partnership conversations. Sometimes those are relevant to funding as well. So when we apply for external funding, showing that we have a clear description of how we collaborate across organisations is very important. But we are aware it's used in different ways, and some people use it more than others. Some elements are used more than others. I think the shared outcomes are more familiar to health partners than some other partners, and the vision is maybe less used than some of the other elements. Obviously, the health and wellbeing strategy is used and reviewed on a regular basis, and the inclusive communities framework through the communities board. The different elements have different types of governance and engagement. We want to maximise the purpose and meaning for us all. So why now? So we've got in local government multi-year funding coming. That's the government's commitment. That increases the need to plan for the longer term. Obviously in the health space, we're used to 10-year plans, and we've got a longer term health and wellbeing strategy. But some of this partnership is about cross-sector working with businesses, communities, the council and health partners. Some of our key strategies require a reassessment. So the health and wellbeing strategy, we're in the middle of delivering it, of course, but we're about halfway through delivering it. And I know partners, I know that some conversations have happened about the progress we've made and where we can continue to make progress in that area. A lot of the content was agreed a long time ago. So the vision is roughly 10 years old, and the shared outcomes about 8 years old, apart from one of them, which is about 3 years old. So, you know, some people will be more familiar with this if they've used this in the work in the past 10 to 8 years. But a lot of people won't have been engaged in the development of this at this point. So it's important that we revisit it. And as a council, we also had a corporate peer challenge back in November, and some of the feedback from that, including from partners, was that we should pivot towards a longer term planning horizon, partially because of the multi-year settlement that's coming, partially because of changes in the health world, partly because of changes in West Yorkshire Combined Authority. There's a lot going on at once. Now feels like the right time to be looking at that. Next. So our engagement plan, that's the current framework as we've shown before. We are between now and probably early September, to be honest, gathering views, obviously across council services, but crucially from partners. As I said, we can't deliver any of this apart from in partnership, and this is most useful when used in a partnership forum. We're happy to take further feedback by email or one-to-one, as well as in these group discussions. Sorry, just go back to, yeah, it's okay. We will then use the feedback from this initial feedback to feed into a refreshed version, which we plan to take to the Picture of Kirklees event that's happening currently planned for the 6th of November. For those of you who haven't been before, that's an opportunity to come together from multiple sectors, business, communities, health, and so on, and talk about how we work together. So we'd like to take that back there. So we really welcome people's views. So on the next slide. So our starting assumption is none of this is fundamentally wrong. You know, the desire to deliver a sustainable economy, for example, which is one of the shared outcomes, or the desire for people in Kirklees to be healthy and well, the desire for people to be independent. We're still committed to those shared outcomes. But as I said before, a lot of this was developed a while ago, and it's important that we revisit, you know, is the wording up to date, or is there something missing? Could some of it be rationalised and focused? Is there a better way that we could use some of this as well? Because we don't want it to be sitting on a shelf if there's an opportunity for it to be more helpful. As I said, we're happy to have further conversations outside of this meeting, but we do welcome any initial feedback today. So I think I'll go into the next slide. We've covered that. As I said, what is the partnership framework? We've got the vision. That's a long-term aspirational vision for the future of the borough, agreed by the council and partners around 10 years ago. The shared outcomes describe the success and the impact that we're looking to have. All of us contribute to those in different ways. The partnership strategy set out specific priority areas of activity, and the health and wellbeing strategy is a key one of those. We're proposing to publish the partnership framework as a kind of separate document. A lot of authorities and districts have a separate district plan or district vision or something like that is separate from the council plan. We have to date published it as part of our council plan, which is our corporate plan. We're going to publish it separately, I think, to emphasise that partnership element. So the vision is on the page there. So it's for Kirklees to be a district that combines a strong, sustainable economy with a great quality of life, leading to thriving communities, growing businesses, high prosperity and low inequality, where people enjoy better health throughout their lives. So again, we don't think any of that's wrong. Of course, we still want to deliver all of that. But, you know, is the wording right? Does it reflect how we currently talk about our aspirations for the district? Is it relevant to your aspirations and across your organisations? How is it helpful? Should we add a time frame? Some places have a time frame attached, like a Vision 2040, that sets out how we want things to look at a specific point in time. Yes. The shared outcomes are up there. There's 8 of them at the moment. So we've got Shaped by People, which was agreed, I think, roughly 3 years ago, and the rest of them around 8. So we want children to have the best start in life. We want people to be healthy and well. We want people to be independent in Kirklees. We want people to aspire and achieve. We want a sustainable economy. We want safe and cohesive communities, and we want a clean and green environment. And you'll see on the right-hand side there that there's each one of the outcomes has more details underneath them, which includes some measures that we do use for our performance reporting in the council on a periodic basis. Are those outcomes the right ones? Is there one missing? Is 8 too many? You know, some places have 3. When we looked at other districts, some places have 5. So we're really keen to get your feedback. There's an important thing that's not in that diagram, which is we have our own efficient and effective outcome for Kirklees Council, and that's just our commitment to operating in an efficient and effective way. Given the drive for partnership working, and we were talking about some of the health changes earlier and the importance of partnership working, given that drive, and that's happening in the economic world as well, and the community sector obviously relies a lot on working with all of us, should we have an outcome in there that's a commitment to shared transformation and shared efficiency? You know, how are we working more efficiently and effectively together? As I said today, we've just described that as a council commitment, but our partner's interested in something more prominent around partnership working. Should we have action plans underneath these outcomes? You know, there's different ways of making these outcomes more real as well. And then finally, on the partnership strategies, you're obviously very aware of the health and wellbeing strategy. The Inclusive Communities Framework is owned by the Communities Board, similar to how the Health and Wellbeing Strategy is owned by this board. The Inclusive Economy Strategy was recently approved at full council and sets out our aspirations for inclusive economic growth in the district. A lot of that ties to workforce issues and so on that we're all benefiting from, and challenges that we all have. And the environment strategy sets out our aspirations around adaptation and net zero and so on. Is there anything missing from this set of strategies? We've had some comments so far around the prominence of education in there. We've had comments around community safety. Inclusive communities is part of community safety, but it's not the whole picture. We also have a community safety partnership plan. Are there other things that you think are vital that we want to bring into that key partnership strategy space? Where are we already good at that strategic coordination, and where do we need to strengthen it? So some of this is not just like what documents do we have, but it's how we're using those, how we're using them well, how are we confident that we're delivering on aspirations when we agree something's a priority? Are we delivering it well together? Where are there issues? Where could we do better? I think this is the opportunity to flag some of those. Is there another slide? Yeah. Okay. Thank you. So the last slide is just to thank you for your any thoughts and comments, the initial thoughts and comments you've got today. If you want to have a follow-up conversation one-on-one, or you want to provide feedback in writing, there's an email address on the slides, which is policy@kirklees.gov.uk. But as I said, really happy to have a chat as well and we'll build all your comments into the stuff that we take to Picture of Kirklees in November.
Thank you, Stephen. And it's great to be looking again at partnership. We started off the meeting that way and ending it that way. It is the only way we're going to get through all this and improve the lives of our residents. You talked about transformation and whether we should have shared goals on that. I think that neighbourhood level of working that we're looking to the future on is something we really need to be working to shared goals. And that overarching well-being, I know well-being's a word that's bandied around, but we know what it means. Those longer, healthier, happier lives that are all encompassing are so important. It'd be great to get some feedback, Vicky.
Thanks, Chair. So, I mean, I welcome this, and then I'm going to say something that's probably going to sound negative. I think there's a range of things, isn't there? Because they're the right things to do. I wouldn't be wanting to add any more big strategies at that top level. I think the other thing is about having it high level enough with our aspirations and something measurable that then is taken back by our partnership for the detailed action plans that go underneath, because each organisation and each partner should have their actions that contribute to that aspiration for Kirklees. So if I liken it, West Yorkshire keep talking about North Star metrics, so they have 3 big metrics for the whole of West Yorkshire. What we then do at Place is say all of our programmes or priorities are doing this, and this is how we'll evidence that they're contributing to those 3. And that's how it feels to me to get that real buy-in and ownership. Otherwise, we end up with something that's too big and unwieldy, and it ends up being a doorstep sitting on a shelf and people don't know. And I think it's fair to say, and I'm going to look at Steve over in the corner, certainly within the ICB, we've spent a lot of time as these strategies have done, the economic strategy, how we embed that within our business as usual. Because otherwise it does feel like actually that's the council's and it's not ours, and it's getting that joined up element to it. So they're my general comments there. And I think also let's make sure we play it into some arenas. I'm not saying take it to every meeting we've got, but let's get some key people who are going to gather it and feed it back to you and make sure it's played in at the right levels.
If it's all right with you, Stephen, I'll go around a few people and then maybe come back to you for thoughts. Carol?
Thank you. Of course. Of course. I suppose it's a bit similar to Vicky's. I'm not going to put it anywhere nearly as eloquently, and it might be a bit controversial. So there is something for me here about how do we make this real? Because we can have all these strategies and we can all say, yeah, we've got a lovely partnership, we all get on right well, and it's made no difference. I was going to say something else. It's not made the significant difference that we need it to. And one of the things I was sat reflecting on is, and I think you asked a question of, do we need to put some... One of the things I was thinking about was, how do we use our resources collectively? Because if we're really going to shift into this neighbourhood space, that collective use of resources and the mindset to think this can be different, we can do this differently, and there's not winners and losers, there's just a winner, which is whoever we're trying to support. I just think that's really important, and I wonder whether that will help us make it more real. And I'm up for a conversation if I can help anyway. I'm not just chucking it on the table. I just wonder whether that might make us think differently and challenge ourselves a bit differently. I hope I've not been too controversial.
And Liz?
Better? Yeah. So I think that really good to see this about partners working together. Similar comments to Vicky and Karen, I think. So I think the question about do we need outcomes? Yes, we definitely need outcomes. It's good to see it's outcome based, and they should be based around population health needs. We will need action plans underpinning them. I suppose one of my questions is, where will this report back to? If it's going to, at the moment it's reporting into the council, if it's a partnership entity and we're working together on it, where does it come back to, and how do we get supportive challenge on meeting those actions? You've put a question in about time frames, which would it be 10 years or 15 years? there's so much change at the moment in there. Some of these will be very long-tailed actions and we're going to need a long period of time, but I think the timescale would be really critical to think about what is realistic so that we're not just doing the long-term things, we're doing some short and medium-term things as well that are going to make a difference to the population now. So I suppose it's comments in a similar vein, and when Vicky talked about the 3 targets, and there was 8 in here, because when I was reading it before the meeting I thought, gosh, this does look, could be a bit overwhelming. And if we're covering those things somewhere else, could there be some really big meaty targets that we all focus on together? Just from a personal point of view, looking at it thinking, ooh, that looks like a lot, but in partnership we can achieve a lot, but let's make it realistic. Right.
Anyone else? Liz?
Hi, I think, yeah, it's really good and it's great to have this consultation. Similar to what I said when Edward Highfield came to this board to present the economic strategy, for me I think the one thing, it's not missing, but it's not explicit. And I think what underpins all of those 4 strategies are the social determinants of health. And I think if a partnership action plan could be developed that was linked and shaped around social determinants of health, then all of the partners sat around the table start to see, it's like shining a mirror at them. So that what Karen and Liz have just said, they can all see their part that they're going to play in achieving that end goal. So it's not for, it's almost like something that cross-cuts the lot of them. I think the other thing as well for me is, and it's something that came up at our development day that we had, but also in recent discussions. So we are a UNESCO learning city. We at the university have a chair in global health and education, UNESCO, and they were talking about not just social determinants of health, and I've written it down here because I thought, oh wow, but commercial determinants of health, digital determinants of health, and environmental determinants of health. And the UNESCO team are pushing through that. That fits with all of those 4 strategies we've got. But I think to develop an action plan or a delivery plan that has the nuts and bolts of all of that in it, everybody owns it. They can see their piece in it. And I suppose what I've done at the university, we have 5 academic schools, and to try and get them tied into the vision for the National Health Innovation Campus, I've got them all mapping their teaching and their research activities against social determinants of health. And it's transformed things because they can suddenly see where their role is in it. And that's what we need for this, to really achieve that partnership working, I think. I don't know what others think.
Steve?
Yeah, thank you. I think my thoughts, I've mentioned these in other forums as well. I think in doing this kind of an approach, there's a bit of an art and a bit of a science in it. So the world is big and messy and complex, and the whole range of things that everybody's doing can never be captured by a small handful of key strategies or documents. And I think we just need to kind of acknowledge that. So it's getting the balance right between having that genuine partnership focus on the right broad areas without kind of trying to over-engineer some of this. I think there's a bit in here for me as well about that link to things that we can measure to demonstrate whether we are or aren't making a difference. Because I know when the outcomes came out initially, we did do some work around developing an indicator framework that sat underneath it. So it's probably worth thinking about where we got to with that and what lessons we learned from that. And then I guess the other bit as well is about, so the delivery mechanisms for the strategies, the 4 top tier ones as they are, they've all got some kind of delivery mechanism that are some version of a partnership approach. I wonder if what we maybe haven't got quite right is the overall partnership that kind of oversees all of that, and whether that's something that we need to think about. And the only bit in this that I didn't recognise was the actual partnership vision, which I know I've mentioned before. The rest of it I could reference and talk to. So again, maybe thinking about how we genuinely get a partnership vision through all of this process is probably something that's quite important. So.
Anyone else? So, yeah, I'm taking a few things back from that. I mean, I was talking to Stephen before we started, and I was saying that, you know, the real thing at my heart, just internally within Kirklees and the council area, would be to get wellbeing at the heart of every service, and that being the goal. Why are we doing something? But it really is, you know, that's a casual term for those social determinants of health. That's the technical side of it. So if we can do that spread wider, and when you're talking about partnerships in here, we are looking still at the construct of the Health and Wellbeing Board and who's on it, and we need to make sure that we are very much striding away from health. Very important, you need that, but the other connections in the commercial and the economic and regeneration are so important to support our individuals. Would you like to come back on all those comments, Stephen?
I won't come back on each individual one, but they're really, really helpful, really good. I think, yeah, some really good questions to follow up on. Good questions about overall oversight and reporting. You know, we take some of this into the partnership executive, but that's one particular forum, and not all of you are engaged in or have been engaged in that group. And a real focus on delivery is what I'm hearing as well, and measurable delivery. I think the points that Liz was making about the common thread potentially being the social determinants of health, we'll definitely follow up on that, because I think what we need is some easy way to describe this, and I think social determinants of health is something people recognise, isn't it? So yeah, so we've heard that, and I think the point about North Star measures and, you know, having potentially a tighter set of things to focus on is really helpful feedback as well, because I agree with the point about it potentially being you know, quite a lot, and it's quite a lot to remember for everybody as well. So thank you very much. Yeah.
Yeah, sometimes there's a lot to put in things, but it's making it meaningful so that it doesn't disappear under the paperwork, as it were. So I'm sure you're all across that, Stephen. You do have time till, is it the 5th of September to feedback?
5th of September, you can get in touch with us. There was an email address in the slides, which are in the papers today. We can have one-to-one conversations, or you can send us further feedback in writing.
So that's great, and thank you for that. We will be sending out all the presentations, unless there's any reason not to. Yeah, can we do that? Can everybody make sure Jenny has them and you can send them on, so that the contact details for that and such are in them? And actually that concludes our formal business of today. But I'd like to make a couple of special mentions, because we have a couple of people who are in the room that you usually see every time we're here, who aren't going to be here again. And I just realised this is the last time we're going to be in a formal meeting, even though they've got a little bit of time left. So we'll start with not my right-hand woman, my left-hand woman here, Alex. Alex is moving on, and she's been personally a fantastic aid to research, setting me right, coming back with stuff at a level I can understand even, that's not too highbrow, that's usable, but it's got a really deep meaning in. So thank you very much for the support you've given me, Alex. And Emily. Emily is moving on. She's been stolen away. She's introduced me to all things public health. She's managed to get me rather overexcited about loads of things that I'm never going to stop on now. Yeah, and then calm me back down. She's got my number, but you know, I'm ever grateful for that, and for the fantastic direction that she's set us on in Kirklees generally and the council. But working with those partners, she's been a fantastic conduit in and out, and keeping people tied up. She's going to be sorely missed. I'm going to hand over and let her tell you where she's going, because then she can tell you what her new title's going to be.
Okay, thank you, Councillor Addy. I really appreciate that. I can't quite believe I'm here at the last Health and Wellbeing Board. It's felt like I've been going for a long time, and then the last 6 weeks have gone in a heartbeat. I am going to Rotherham, which I am reliably informed I'm saying wrong. And I need to reduce the number of consonants in it. It's Rotherham. And I'm going to be the Director of Public Health, which is very exciting and also quite daunting, but mostly exciting. I'm trying to focus on the excited. But there have been some brilliant things that we've done in the last 7 years that I've been here, things that I'm really proud of, and relationships that I hope will continue even when I have gone to South Yorkshire. So thank you all for all of your support. And I'm going to stop talking now.
So thank you very much, and also thank you to everybody for being here today, and look forward to seeing you at the next one. But of course, as we always say, the real work goes on in between the meetings, so please keep in touch. Please keep in touch with each other, and let's keep moving forward on the wellbeing front.